Hello, Daniel. Welcome to the podcast. Thanks for accepting my invitation. You're a general practitioner based in Wales in Brecon Beacons, but you develop rather unconventional and exciting portfolio career. Could you share a bit more about yourself and various roles under this umbrella of portfolio career?
Yeah, well, first off, thanks so much for the invitation. I think it's going to be really good to have a chat. So yeah, I'm yeah, it's that fashionable term, isn't it now? Portfolio GP, and what exactly is that? So I suppose for me, the key when I finished my GP training in 2017, and I was sort of looking around, all my peers were going off to be either partners or salarieds, and I sort of thought, not sure about that. Need to kind of take stock, as it were. So I actually, the first thing I did was go on a few months holidays. But then when I came back, it was sort of like, hey, there are bills to pay, life responsibilities and things. So yeah, it started off with locum work, which is, it's got to be the bread and butter of paying your bills and things like that. Um, so yeah, I do a mixture of sort of locum, out of hours, stuff like that. But the things that really excite me, I suppose, more than general practice, are is sort of expedition and wilderness medicine is probably my main interest. So that's going as the doctor on an expedition or working on an ultramarathon, something like that. And then some of my other roles have kind of stemmed from that initial interest. So I also do some travel medicine work with Nomad, who are a large travel medicine organization. And then from that sort of expedition, wilderness, travel medicine angle, I've also got involved in medical education. So I work for a few companies to upskill other people who want to do similar things. And then what else do I do? I'm just trying to think to myself. I think the other stuff I do is a bit more volunteer based. So I have a few volunteer hats that I wear. Probably the most significant in terms of the time that I spend doing it is I'm the medical director for a telemedical charity called the Virtual Doctors, which we can talk about a bit later. And that's a really interesting role because it kind of combines volunteering in low and middle income countries, but you can do it whilst still at home or in the UK. So that's quite fun. And then the other two things I do is looking a bit more at pre-hospital medicine. So a bit of volunteer work with the Welsh Ambulance Service, so going out with some other medical professionals in an enhanced care sort of role. And then more recently, just in case that wasn't enough, I've joined the local mountain rescue team, and I'm a trainee member of Brecon Mountain Rescue Team. So yeah, quite a few things. I sort of keep looking out for more almost, which is an interesting strategy.
You're still looking for more.
Well, I guess it all comes back to that wanting that variety and stuff to kind of keep interested in medicine and in life in general, I guess, because I think the thing that I noted was, looking well from finishing medical school, I think you do your junior doctor years and they're that kind of novelty, you're like, oh yes, I've finally got a job, I've jumped through those hoops, I've finished. And being a doctor at first, it's obviously that steep learning curve, but it's kind of cool, it's exciting, it's a privileged position. And then I think over maybe the next 18 months or so, that kind of initial gleam maybe wears off. You get that actually, and I'm sure this will be familiar to people. You kind of maybe get a bit jaded, get a bit worn down, and that's probably even more so the case now. And I just sort of looked around at all the more senior trainees, senior registrars and consultants, and was like, I don't want to spend the rest of my 30s and 40s, weekends, nights living here. But then a similar thing happened during my GP training. I think for me, I went down that route because it was the quickest way to become autonomous and get a relatively fast CCT. But then I also didn't want to sit in a GP consulting room until retirement and then think what happened there. So I guess that's how I sort of ended up looking for all these different things to do to sort of enhance and complement that, which yeah, you still have to do the normal GP work in inverted commas because ultimately a lot of these fun things are fun, but they don't always pay the bills and things. Well, they hardly ever do.
Yeah, but I think, this way of approaching career has quite a lot of advantages, giving you this variety. And obviously myself being GP for so many years, I can understand, how this job can be, and then having those outside GP outlets helps a lot. But you have quite specific, interest, I would say, in outdoors, and not really that much GP job, because a lot of things that you're doing are more around, I would say, maybe urgent care. So what sparked this interest in expedition medicine? Was it like kind of calling from the nature and outdoors, or you were just craving some adrenaline after having, boring job and boring shift in GP?
Yeah, that's a good question. So I think I've always kind of had that interest in the outdoors. I was lucky enough to kind of grow up in a relatively rural area. I was very into sort of walking and more sailing actually and things like that when I was sort of younger and things. But then I think going to medical school in London, I mean, London is obviously the complete opposite. So sort of got a bit away from that. Then obviously you're sort of living in the hospital, aren't you, for the junior doctor times. But I remember going to, it was either careers fair or something like that, and picking up a leaflet which had a few cool pictures on it. And this makes me sound old because it was before they didn't have like Instagram and stuff like that, but it was this cool leaflet, and I remember having it on my desk for a good 3, 4, 5 years or something, and it had something like, go and be a doctor in the desert or the Arctic or wherever. Um, and I kept thinking, like one day I'd really like to do that. And it just sat there on a notice board or something. And then towards the end of my registrar year, when everyone was sort of using their study budgets to go on revision courses for, the various GP exams, I was like, well, you know what? I'm just gonna try it and see if I can use my study budget to go on one of those courses. And I spoke to the program directors, and they were like, I not don't know. Um, if you can write us like an A4 page about how it's relevant to general practice, then let's see what happens. So I wrote something, because arguably I'd say it is relevant and it's a generalist thing. We are generalists. Yeah, and so then they approved that, and I got to go on this course with a company called World Extreme Medicine, who I now work for and teach on and lead similar courses, which is sort of an interesting turn of events. But so I did that. And it was kind of meeting people with that similar ethos. I almost found my tribe, if you like, and that sounds a bit cliched maybe, but it was other people who, yes, they were medical, yes, they liked outdoor stuff, but they were maybe slightly jaded. I'll admit that I probably was, looking for other things to do. And then it was sort of like 4 or 5 days of lectures on various different medical issues, but out of, not in a hospital, not in a consultation room in a GP surgery. And I was like, you know what, this sounds kind of interesting. I sort of also thought it sounded terrifying. That sort of um, you kind of realize like there's so much you don't know about things. So it's sort of like you'd have half an hour or an hour on a certain topic, and I was like, okay, yeah, this is super cool, but I don't feel like now that I've done this 4-day course, I should be going into the middle of nowhere on my own. It sounds like there are some learning needs, if you like. So then I ended up doing a diploma up in at the Royal College of Physicians and Surgeons in Glasgow, which had various different modules and outdoor components and things. And then that led me to be interested in tropical medicine. So I did the tropical medicine diploma in Liverpool. And then once I had that sort of base of knowledge, I was like, okay, I need to stop getting addicted to doing diplomas because they're expensive. Yeah, they're just your diplomitis. They're expensive. That's the trouble. Learning is expensive. Furthering any interest is it tends to cost money. But then I thought, actually, you know what? Let's get on with doing some trips and things. So I guess that's where that kind of interest came from. And then from there, I've then sort of tried to look at lots of different, so all those other roles I do, I guess, they link in a little bit and they sort of feed into each other. And at the time, you never know which, some of them might not work out. But then luckily, I've been quite lucky that they all seem to fit quite well. at the moment, and I'll pick up some knowledge and skills from one area that I can then bring into one of the other roles, which is quite nice.
Yeah, so the expedition medicine obviously has its quite unique challenges. So besides clinical skills that you already have from your training or additional courses, are there any particular non-clinical skills that are required for success in this field?
Yeah, yes, is the answer. The short answer is yeah. There's so many. I think because on one level, you're going as an expedition doctor or paramedic or nurse or whichever, and it's kind of assumed that medically you'll be at a certain standard, and you need to be competent at the clinical things, of course. But the last thing you want to be is a liability to that expedition. It's a bit embarrassing if you're accompanying a trek and you're the slowest person, for example, or the person who doesn't have the right kit, so hasn't got very good waterproofs, for example, or something like that. So you need to be physically and mentally fit, because actually there's the whole expedition itself, and then at the end of the day, that's often when your kind of doctor role starts, because everyone's like, oh, I've had all these problems, I've had all those problems, and you've been walking and doing the exact same exertion as them, and you probably just want to go to sleep, or have a rest in your tent. But that's often when they come and hassle you, and you're kind of permanently on call. A lot of the time, it's all fine, but there are those stresses, and you need to have that resilience and that way of kind of dealing with that, I guess. Yeah, and obviously, like I was saying, being physically fit, and that's important, and having that overall situational awareness into what's actually going on. And I think probably the most important sort of non-clinical or non-technical thing is human factors. So on these courses that we teach on and things like that, you can't sort of overemphasize how important it is, because if you're going on a trip, whether that's you as the doctor or the leader or even the participant, you're going to be with people. Usually, you've not met any of them. And statistically, we unfortunately don't all get on with each other, do we, as humans? And sometimes, whether that's you and another team member or that's various team members, there will be clashes of personalities. Different people see things in different ways, and often you might end up being the mediator, or it might be that you and the expedition leader or something don't see eye to eye, and you think, great, I've got to do this trip for the next few weeks. How am I going to negotiate this? But I guess it comes down, and people listening will have experienced similar. I mean, you get the exact same challenges in any situation, don't you? I suppose from that point of view. I'm sure everyone can remember hospital teams where the dynamics haven't been maybe quite as good as it could have been, and that it always affects sort of how the team operates and things. So one of the nice strategies that we always try and do on an expedition is you kind of have to get all that out in the open. Like, the worst thing is having a bad team that just festers and becomes something that's a lot worse. So having that kind of honesty and environment of safety where people can kind of share what they're feeling and things can sometimes help with that. But yeah, there's so much. We could do a whole podcast on human factors.
Yeah, this is interesting. I was wondering how much time you really need to dedicate to prepare for the expedition when you go away, especially that you don't know the participants, who are the biggest risk usually in the expedition. And do you screen people? Do you prepare them somehow earlier? How it looks like?
Yeah, so it really varies. So I've done trips with youth development expeditions, and I've done sort of more charity challenges with usually with adults in different environments, and then also worked on TV shows. So and it completely varies a lot depending on the type of event, but also the type of person. So a lot of the stuff we were doing with young people, they were quite vulnerable. They often came from the fostering network and other sort of similar organizations such as that. So we were much more conscious that you're taking them often from urban areas into places where they haven't been before, but it's kind of quite an extreme change, they're more likely to find it difficult potentially. So then we'd front load things a lot more. So yeah, you'd have screening, but you'd also meet them all face to face, have sort of team building, campcraft almost, making sure they know how to put up tents, use stoves, things like that. So that was with an organisation called British Exploring, who are really good, and that was going out to Canada, and then we did similar up in Scotland as well. The charity challenge type stuff is a bit different. You tend to get a screening form will go out to participants, and it will say, tick this box if you've had a breathing problem, if you've had any mental health issues, so on and so on and so on. And they'll tick that, send it to the company, who will then send that to you. So there's a lot of time sort of looking through spreadsheets and things. But as you know, a screening performer is only as good as the information that gets put on it. So you're relying on people to be honest and disclose things. So sometimes people don't disclose things because they think, well, if I tell you that I have XYZ problem, particularly mental health issues, but also cardiac as well, that you can say, well, you can't come on the trip, so I'm just not going to tell you about it. So a lot of that that can cause issues, particularly if you're finding out at the airport or in the middle of a remote place. I think a lot of it's how you frame it. So if you're framing it that it's actually an enabler, so that we can optimize outcomes rather than put up barriers and stop people from coming. But yeah, you normally get some information at least, and then you may need to talk to the participant or email their GP or specialists. It used to be that some organizations would get things signed off by a GP, so it was factually correct, but that doesn't really happen anymore because GPs are too busy. And understandably, we were charging money because it's a private service and people didn't want to pay it. And then, yeah, it caused an issue. But yeah, so yeah, there's usually some screening. It varies quite a lot on, depending on what's going on. I'd be concerned if I was going on something where I had no information about anybody. But sometimes that's the case when you're working on these ultra events. There might be a bit of information, but quite often there isn't. And you just have to, if someone's unwell, you just have to hope they're conscious and sort of take that history and things.
Yeah. So this job took you really around the world. You've been to pretty remote corners of the world. Could you share maybe a memorable moment, frightening, exciting, or inspiring from your expeditions?
Yeah, well, luckily I've not had too many frightening ones. Touch wood. I don't want to jinx it. Yeah, I think most inspiring one, and it's not a medical thing actually. So this time last year, I was lucky enough to go out to Canada again, to the Yukon, so a pretty remote part of northern Canada, and it was kind of -30, so a bit chilly. And this was supporting the Montane Yukon Arctic Ultra Race. So this is where a select bunch of people, who are slightly mad in my opinion, decide to then either cross-country ski, walk, or fat bike, pulling their own accommodation behind them, so on a pulk usually, or all attached to their bike, and they can do either 100, 300, or 400 miles. There are checkpoints where they can get seen and checked up, and there's mandatory medical checks at these points to make sure they're not getting frostbite or any other problems. Anyway, so I was working on that event, which was great fun. And I remember one night just going off from so we were at a remote checkpoint near a frozen lake. It was beautiful. And I thought, you know what, I'm just gonna go and bivvy out in the snow, light my own fire, and lie out under the stars, obviously with all my layers on because it was really cold. And that was amazing. No natural light at all, so I could just see the stars, the fire wrapped up. And then I was just like, yes, it's all worth it for these kind of moments.
Sounds fantastic and freezing at the same time.
Yes, well, I won't lie, I was wearing all the clothes.
You mentioned a couple of diplomas that you did in preparation to your role. If someone would like to follow your steps, what would be a first step, what kind of diploma would you recommend doing in first place?
Yeah, I mean, I think as a first step, I wouldn't necessarily jump straight into diplomas. I'd probably try and go on one, well, partly because of the the commitment with any diploma and things. I'd probably suggest going on one of these kind of week courses, and there's various different companies that run these. The website Adventure Medic is very good. It has a list of all the different courses and also reviews from people who've been on the courses, and that can give you quite a good taster. In terms of diplomas, again, there's a few different diplomas. There's the one I did. There's a few other ones that have cropped up as well. It's interesting because actually the field of wilderness medicine, it's not like general practice or anesthetics or anything like that. There's no Royal College. There's no sort of you must have XYZ in order to be able to do this trip or that trip. There are some competencies that have been developed by the Royal College of Surgeons in Edinburgh, which act as a kind of a guideline as to sort of things that you should probably be able to do if you're going a certain distance away from definitive care and things like that. So a lot of it's all that kind of grey area. I sort of thought doing a diploma was a good idea purely because if something, didn't go quite right, or I had a complaint or something like that, and then they say, well, what's a GP doing? If this isn't a GP surgery, clearly, I can say, well, at least I've done some CPD, I've put in some effort to get some other qualifications and things. So yeah, there's a few different ones. But probably the one I'd say is most useful actually is not it's not a diploma as such. It's the pre-hospital version of ATLS, so Advanced Trauma Life Support, but it's called PHTLS, and it's pre-hospital trauma life support. Personally, I think all junior doctors and GPs and everyone should do it, because then when you come across an accident or something like that, when you're driving along, you actually have the skills and the knowledge to be able to deal with it. But that's probably an aside. But that is actually the recognised qualification. It's one that the ambulance service often do, and other organisations like that. So that's probably the most useful, because you probably a lot of the time you're dealing with general practice. Most of the time on an expedition it will be, oh, doctor, I've got diarrhea, I've got vomiting, and then you ask around and everyone's got it. So a lot of it is public health, gastroenteritis, dehydration, sore feet, blisters, loads of. If you don't like feet, then yeah, it's not the thing exactly. Like so many, more so on these ultra events, but so many feet. And then a lot of it is also mental health. So much of it is that sort of pastoral support role, talking to people about how they're feeling, what we do sort of day to day. But you can't underemphasize that. But it's also thinking, okay, so as a male GP, I might not do as much gynecology, but when you're in the middle of an expedition, if there's a woman with some sort of gynecological problem, then you're the gynecologist, you're the psychiatrist, you're everything. And this is what I say, because a lot of people say, oh, I should go and do anesthetics if I want to do expedition medicine. And you're like, well, yeah, you could do. It'd be really good if your patient's unconscious. But actually, and that's a bit of a jab at that, but you need to be able to do all those other things. Yes, if there's a complete disaster and an airway issue, yes, you'll be really good as an anaesthetist. You'd probably argue that if you're in the middle of nowhere, that's maybe a bit irrelevant. Well, but like jokes aside, it's working out. Do you have so a lot of what I did when I was doing these diplomas and things like that, you kind of have to do a skill self-assessment almost. So I was just like, wound care, for example, that's something that in in A&E or in GP world, it's often done by the nurses. And I was like, well, there's so many different dressings. Some have got iodine in them, some of them have got this, some have got that. I was like, I've got absolutely no idea. So I spent some time sort of finding out about those. And when I was working in Fiji, ended up doing lots of wound care. So that was quite useful. So it's all about identifying those gaps and thinking, okay, that will be me that has to deal with that, because there's not like the the specialist that I can suddenly refer to, because it's just me in the middle of this expedition.
Yeah, so that nicely sums up why why this is kind of generalist job with maybe some specialist upskilling, I would say. Now let's move closer to home. You travel a lot, but you also are involved close to home in work with mountain rescue team and basics. Yeah, is that right?
Yeah. So close to home is important because it's always a balance with, and this is a question I get asked a lot, is that how do I maintain going on these expeditions with sort of a normal career, I guess. I guess part of the answer is through locuming, because as a GP partner or a salary, it would be tricky, not impossible, but a bit harder. So yeah, I have, and also I've got a 2-year-old son. So some of it has been looking at how can I do similar things and keep those skills up to date whilst staying close to home. So mountain rescue is a relatively new development for me. So I'm a trainee member of Brecon Mountain Rescue, and I've been doing that since sort of November-ish last year. So still very early on. Really steep learning curve. Not really the medicine, but it's all the other stuff, all the technical rope work and things. I'm not a climber, so a lot of it is completely new. Really interesting though. Really enjoying it. And we have various different competencies that we have to learn and then be assessed on before we become operational at things. So that's really fun. And that's something that I've been wanting to do for such a long time. So I was super pleased actually that that's starting to take off. And then before that, I've been involved in basics. So again, that's the British Association for Immediate Care. So it's basically it was set up by GPs, actually a bunch of GPs back in I think the 60s or the 70s. It's essentially changed now, so it's largely anaesthetists and paramedics, pre-hospital emergency medicine consultants and things like that. But it's basically an umbrella organisation, and then there's a bunch of different schemes around the UK. And in general, they tend to support the local ambulance service to provide enhanced care or critical care. The slight setup varies depending on the organisation, but the one I work with is called MedServe Wales, and they're based in South Wales. And we essentially go out in an SUV, so like a rapid response vehicle, which is there'll be 3 of us at a time, usually a consultant or a senior paramedic, and then 2 other people. And the car will have the kind of kit in it that you need to supplement the care that a normal ambulance truck can deliver. So often we go to RTCs or cardiac arrests where extra support is needed, or if someone needs sedating and things like that. So more recently, we were called to a preterm delivery of twins. I think they were 29 weekers twins, and then the mum was having a postpartum hemorrhage, so that was all a bit chaotic. So it completely varies. It's certainly one where you find, well, from my perspective at least, that I'm out of my comfort zone, and that's why I do it with other people. Like, so for me to do that as a solo person would not be responsible because I don't have that skill mix. So for me, it's again a learning opportunity. I'm gradually working towards completing various different courses. So there's obviously the pre-hospital trauma one that I mentioned a few minutes ago. I had to remember ALS, so I did ALS, now teach ALS courses. I'm happy to run cardiac arrests out of hospital and things like that. But then there's other things that I need to work out a bit more about. Where will my competencies lie? So from an airways perspective, I don't intubate. I can use an iGel. Am I going to learn to intubate? Probably not, because it comes down to getting competent at it, which I could arguably do, but then how do I maintain those competencies? So a lot of it is an ongoing discussion with the team and things, but they've been really welcoming, which is good, particularly because general practice is not as sort of highly represented as it was when the whole of basics was set up, but there are still there are still a fair few GPs doing it. I'm actually in the process of writing an article about basics and general practice that will end up on GP Online hopefully in the next few weeks. So if anyone is interested, they can keep an eye out for that as well. But it's something that if people are interested in, it's a case of kind of if you go to the basics website, it has a list of different schemes, and you can get in touch, do some shadowing, and sort of see what happens really. But it's been good for me because it meant that I can keep some of those skills and learn new skills. And I'm eventually aiming towards another diploma in immediate medical care, which is sort of the gold standard for practicing in pre-hospital environments. And that would sort of mean that I'd hit a certain level of competencies, which is important, I think, because there's that fine line between getting involved in lots of different things for variety, but also making sure you're clinically competent in all of those different things and not actually doing things that you shouldn't be. Do you know what I mean? From a kind of a governance and safety perspective and things. So yeah, it's important for me that I make sure that I am doing all those things. But I think I am. So yeah.
Yeah, I'm familiar with basics, from my previous job in rural Scotland.
Yes.
Essentially, at least I think in Highlands, there's still a lot of GPs involved in that. I'm not aware of
Yes,
many.
I think it's slightly different in Scotland
Yeah.
in that, because everything is so remote. I think most so when I locum up in Scotland, they give you the sandpiper bag, and defibrillator, oxygen concentrators, all sorts, enough to set up your own small hospital, really. That's for the out of hours at least. So I think it's different in Scotland. So people like I think that whole rural GP idea is really good. It doesn't not quite remote enough in where I am in Wales for that, but that does sound quite fun as well.
So in this team of rural medicine, let's move to Africa. So you're medical director of Virtual Medics.
Virtual doctors.
Virtual doctors. What is the mission of this charity? What is it doing?
Yeah, so the Virtual Doctors is a fascinating organisation. So it was set up by a chap called Hugh Jones, who he's an English chap, and he used to work as a safari guide out in Zambia. And so he's not medical at all, but he witnessed a lot of potentially preventable morbidity and mortality, and a lot of stuff surrounding sort of pregnancy and childbirth, and he often tells a story of a particular case where he was driving home from taking some clients out and saw a trail of blood along the side of the road and thought it was probably a wounded animal. And then he caught up with a man on a bike pedaling and had his pregnant wife on the back who was having a antepartum hemorrhage essentially, and he put them both in his jeep, tried to get to the local hospital, and unfortunately she died in his vehicle. And he didn't think that, and he still says actually, the virtual doctors and telemedicine and things like that probably wouldn't have made a difference, but it provided that epiphany for him to think, there must be something that I can do. So then over the next sort of 10-15 years, he sort of used all his time basically to set up this telemedical charity. So it's registered as a charity in both Zambia and the UK. And essentially what we do is connect clinics in rural areas where you have clinical officers who will have done a year or two's basic medical training, and then they go out to these centres, which are relatively low resource. They don't really have much in terms of diagnostic capabilities, but they do a fascinating and excellent job of seeing loads of different patients. Sometimes they'll want advice, like we all do. And to get to the local hospital, it can be a case of sending a patient for a day or two's walk, or on a bus or something like that. And then you're having to take your family with you to care for you. But then there's no one working, so you're not earning any money, and you might have to choose between your health and your income and things. And that's really difficult. So what Hugh's plan was to connect those clinicians, ideally with local doctors. But the issue there is that there just aren't very many per capita. So at the moment, UK doctors can support that. We're hopeful that that will extend again to more in-country doctors once we can get them on board, and also doctors from other countries, nurses, physios, midwives, and a much more multidisciplinary approach as well. But yeah, that's the charity in a nutshell, at least.
Yeah, it sounds fascinating. So, as far as I understand, the idea is to support clinicians at the moment from abroad, but eventually the idea is to provide this support within the country. Is that right?
Yeah, exactly. And some of it has been a proof of concept, if you like, um, using UK doctors. But yeah, the idea has always been that it should be self-sufficient inside Zambia. And then Malawi is the second country that we've been sort of running pilots in. And again, we want it to be so that it's local clinical officers referring to local doctors. But then if those doctors are overwhelmed and too busy, there's a sort of a safety backstop, if you like, of international volunteers who can say, actually, these are the sorts of things that you need to do. But we're also conscious that there's no point in an international volunteer saying, well, actually, this patient has XYZ. You need to do a CT scan of their whole body and do 20 different blood tests. Because yeah, it's about giving appropriate advice. Sometimes it might be that they need to go to the next level facility for some investigations, of course. But a lot of the time it's, again, it comes back to general practice a little bit. A lot of the time it's about examination findings, maybe asking some of these questions, delving into one aspect of the history, or saying, oh, actually on examination, could you check for, sort of shifting dullness or something like that? Or actually, yes, we know that all of the clinics we support will have things like malaria rapid diagnostic tests, urinalysis, pregnancy tests. So that it's not like they have nothing. And often it's a bit of guidance, a bit of support and things like that. But we are conscious that it's important to give that correct advice rather than just saying things, and we're also conscious of that that kind of white saviorism. We're giving you this advice because we know everything, and it's very much not supposed to be like that at all. In fact, the way the service was run, so using the smartphones, and it's asynchronous, so not like what we're doing now, it's all text-based, sort of offline, was all suggested by the service users. And like you were saying, the idea of getting it self-sufficient in country is our ultimate aim. And then we sort of disappear fade into the background and go on to another country. But yeah, we do always have to be conscious of how things can potentially look from that kind of ethical and historical perspective as well.
If someone would be interested in working with you in the charity, how they can reach out?
Yeah, so for people that are interested, if they want to go to our website, which is virtualdoctors.org, and there's a form in there, you can just drop me an email, and yeah, I'll let you know. But basically, the things we sort of look for, because we're conscious that we need to have a certain level of experience, we tend to try and get people who have either completed their training or they're relatively senior, so they're a registrar at least, or they've done a lot of work in a low-income country, done the tropical medicine diploma or something similar. Similarly, if they're a nurse or dentist or midwife with similar, or physio, sort of allied healthcare professional, basically with similar backgrounds, we're trying to get a pilot going to get other people involved as well, because actually, like I was saying earlier, if someone comes in and asks lots of wound questions, whether that's virtual in real life, getting some nurses that are much more experienced, and they're going to give much better advice and things. So yes, but yeah, anyone who wants to get involved can check out the Virtual Doctors website. Yes, we're also on Facebook and LinkedIn and things like that as well.
Fantastic. And so the question that has been on my mind in this conversation is you have so many roles, you travel a lot, you quite a lot of time away from home and family. So how do you manage to balance this professional commitments with family life, personal time?
Yeah, that's a good question. I mean, I think most of the time I'm very lucky. So I'm very lucky actually. I've got a very understanding partner. So my wife has always been really supportive of all these things. So that's definitely been an enabler. And in fact, I was out working in in Fiji when my son was 3 months old. Um, and everyone still, including me, doesn't quite understand how that really happened. But so yeah, I've been lucky enough to have that support. But I I think moving forward, and particularly over the last sort of 12 months, I've had to be quite disciplined with myself, and I've had various opportunities, and I've had to say, you know what, actually, whilst that sounds amazing, I can't justify spending that time away from, my family and watching my son grow up and things. Um, it's a difficult balance, I think, and I'm still negotiating it because it's relatively new, but I think that's partly why some of these things in the UK I'm putting a bit more time and effort into. I'm still obviously on the lookout for cool things to do overseas, but it is definitely that balancing act because you don't want to go on loads of cool expeditions and then come home to find that the locks have been changed on your door.
Yeah. So what's in store in the next couple of years for you? Do you have any bucket list challenges or destinations to explore?
Yeah, so I've got so the latest thing that I'm trying to plan is actually linked. It links quite a lot of the things we've discussed actually. So it's an expedition linked to the virtual doctors, but also linked to historical exploration. So it's called Livingston Revisited 2024, and the idea is it's going to happen in September or October this year. And myself and a multidisciplinary team are heading out to Zambia and Malawi. And we're going to retrace parts of David Livingstone's expedition. It's got the tagline from Scottish missionary, because he was a Victorian missionary from Glasgow, to digital missionaries. And that's hinting at some of the things that the virtual doctors do with telemedicine. And we're hoping to visit a bunch of clinics, revisit some of the destinations that Livingstone went to, and also connect new clinics with Starlink or similar technologies. And then at the same time, we want to look a bit at the disease epidemiology, whether that's changed significantly since Victorian times. And we know that data is going to be a bit tricky, but we want to at least sort of explore some of those ideas. And also some of the personal stories that patients and clinicians will be able to share with us, hopefully. And then we're also going to have an educational component looking at snake bite management and also the management of trauma, to try and have a bit of two-way learning and also have a trainer-trainer model on those two topics so that we can cascade that down to other healthcare professionals and things. So that's just a small project that we're working on in the background. And we're also trying to get it filmed as well. So I've got a few videographers on board, and we're hopeful that we'll better produce a short documentary for some fundraising, film festivals, that sort of thing. But at the moment, it's tricky planning something from scratch because all of these things need funds. So the main thing we're doing at the moment is sending loads of emails, contacting lots of different people about trying to get sponsorship and things like that. So if anyone listening is interested, but yeah, that's the one on the horizon at the moment. Which is it's good because for me I've not really planned a trip completely from scratch. So it's a good learning curve.
Right. Okay. So what's the best way to get in touch with you if someone is interested in expedition medicine, virtual doctors, wants to either use your services or maybe support the charity?
Yeah, so probably the best thing is I'm always a fan of LinkedIn. I think that's quite good. So I'm on there as Daniel Grace. The other thing is my website is thewildernessmedic.com, which has a way that you can contact me on that about sort of anything, or Instagram at the Wilderness Medic. So yeah, I'm always interested to hear in people who are interested in expedition medicine, kind of global health, medical education, any of those sort of allied topics, really, because I think it's always interesting to have these chats, a bit like what we're doing now, and open those doors, because you never know where they're going to lead you. You don't know what door's going to be after that one that you walk through. And some of them, you take that side step and you think, oh, okay, this door wasn't quite what I thought it was. But then, when you reflect back on it, you think, actually, you know what, that has lined up. And, some of those things do have a habit of kind of coming back to work it out. So I think that's probably the most important thing, isn't it? I don't know how you found that kind of see your career, always sort of say yes to things, always try and take those opportunities because you don't know where they might end up.
That wasn't my usual approach to it, honestly, but I'm learning to look outside of the box, and I find that this is actually opening, new doors. So yeah, I'm saying more yes now.
But I think I probably need to do that a bit less, because otherwise I won't have any time left. I don't know.
There is this advantage to saying yes, that you may run out of time.
Yeah, of course, there's always a balance.
Okay, Daniel, thank you very much for your time and for taking me behind the scenes of wilderness medicine, virtual doctors, and so on. And I hope our listeners will be as interested and inspired. Thanks for your time.
Oh, thank you so much. It's been really good to chat.